This is Municipal Matters, a show dedicated to sharing the unique stories, challenges, and opportunities facing Alabama's communities while interviewing those that have insight into resources that can make a positive difference.
Welcome to today's show. I'm Lori Jhons, and I'm the Communications Director for the Alabama League of Municipalities. I am so excited to have with me today Commissioner Kim Boswell of the Alabama Department of Mental Health. Today's show, we wanted to focus on supporting Mental Health Awareness Month and talking about some of the things that y'all have going on with your department and some of the initiatives that we can share with our members. So let's dive right on into it.
Great.
I remember when you were first sworn in, I believe it was around December of 2022. And so when we were both serving in the Ivy administration, that was in the heat of the COVID-19 pandemic. And so you really got thrown into the fire getting started as commissioner. But I know that your background has transpired across several decades. Can you tell us a little bit more about your background and your role as commissioner?
Sure. I have a daily reminder of that time because the picture of my swearing in ceremony, we're all in masks.
Oh, yes.
And so it's a very memorable moment. So of course I have a picture on my wall. So it's a little stunning now to look at it and see we were all in masks that day. So it was a very different, challenging time for sure. And so for me, I've worked in state government for many years. I think I've lost count, actually. I'm at 32 years, I believe. But my background really is in social work. So I graduated from Florida State University with a master's in social work. It's a little bit different degree. Most people think of social work as a clinical background. But I really have more of a planning and administrative background. So really from the very beginning, I knew I wanted to work more on the administrative and research side of things. So if you think of it more like a public administration degree, but definitely with that foundation of social work. And I worked in a couple of private hospitals, psychiatric hospitals in our state, did some work in the nonprofit areas, and really came into state government working for the Department of Mental Health, working on our developmental disability side of the house, actually. And then about 4 years in, I decided to transfer to the Department of Rehabilitation Services and thoroughly enjoyed my time there. Spent 10 years at the Department of Rehab Services and then came back to mental health in 2008 and became the HR director for the department. And that was very exciting. And then moved to associate commissioner over the Division of Administration. And then under Commissioner Lynn Bashir, I became the chief of staff. And then in 2020, Governor Ivey appointed me as commissioner. So I've been around a minute.
You have. Tell us a little bit about some of the things that you do as commissioner and what are some of your goals?
So we really have been transforming mental health services in our state. It really began, really honestly, when Governor Ivey first took office. We really began looking at the system and looking at some major transformations that we needed to do. We had some missing pieces to our continuum in our healthcare system that we operate. And so we began working on what we call the Alabama Crisis System of Care. And so we've spent the last 6 years really trying to build out services, particularly for people who are in a mental health crisis, who previously might not have known where to go. We really didn't have services that would be available for someone immediately when they were in a mental health crisis. At that time, most people, when they're in a mental health crisis, they dial 911. And unfortunately, at that time, you were either going to get EMS or law enforcement or both. And the only place they could take you is either to jail or to the emergency room. Mm-hmm. And so the Alabama Crisis System of Care is really designed to address that gap in our continuum of services. And that's one of the major things that we've been working on. In 2022, of course, on a national level, we switched to a 3-digit, easy-to-remember number known as 988. for a mental health crisis. So that was really great timing because it happened right as we were building out our crisis system of care. And it really added to our ability to really make it easy and accessible for people to get into our system of care. And so we've had a ton of initiatives that we have going on. We've done a lot with school-based mental health and a partnership with the Alabama Department of Education and many other initiatives that are really designed to increase accessibility to our services and really make it easy for people to get care.
Those are all great things. We'll definitely dive a little bit deeper into some of them. So we've hosted 3 healthcare summits over the last few years here at the League. And one of the things that we often hear is that we need more beds in our crisis centers. Talking about some of the things that you just mentioned, I know that you and your team have worked to increase those crisis centers around the state. Can you tell us how many we have now and what are our plans for the future?
So we do now have 6 crisis centers around the state. We have crisis centers in Huntsville, Birmingham, Tuscaloosa, Montgomery, Dothan, and Mobile. The interesting thing, though, with crisis centers is they really are available for people who are willing to go and seek help for their mental health issue. And so people who will voluntarily go and they're not necessarily secure facilities. One of the conversations that you've heard a lot more about from your members this past year is what we call our involuntary commitments. So when someone is having a mental health crisis and it's serious enough that they go through a probate process where their civil rights actually are taken away from them because they're a danger to themselves or others, they need a different kind of bed. And a lot of what you hear from your local communities and particularly probate judges and police chiefs and sheriffs and those folks is the need for more of those civil commitment beds. Finally, about 3 years ago, the Advocacy Treatment Center came out with a publication that said you need 30 beds per 100,000 population for your civil commitment beds. It was the first time that somebody finally said, this is how many beds you need, because that's kind of been the question, how many beds do we really need to serve people in Alabama? Wow. Right now, we're at about 15 beds per 100,000 people in Alabama, so we have a really long way to go to address the needs, particularly of those who are more seriously mentally ill, who need to be in a more secure setting and be going through an involuntary commitment proceeding. We really believe that our crisis system of care has prevented a lot of folks from going that direction, and those services are really important in the community for people who can access those services. We really need beds in both of those scenarios. It really is a continuum of care, like I talked about. We really are a healthcare system. And it's like crisis centers are kind of the urgent care, and then the civil commitment beds are your more inpatient, going to stay with us for a little while kind of beds. So we have needs on both sides of that.
Definitely. When you talk about, maybe the officers seeing someone who's going through a mental health crisis, talk about, I guess, the challenge is not only for them, but also even, let's say there's a family member that sees a loved one that needs some help. What's the process like for them getting that person help, whether it's the voluntary way or through, I guess if it's the officer, through the involuntary way and getting the courts involved?
So the easiest way now to really navigate our mental health system is to dial 988. Because there is going to be someone on the other end of the line who is familiar with both of those processes, whether it's voluntary or involuntary. There's going to be a counselor there if it's a more serious issue and you really need some counseling at that moment to help you work through where you need to go, what you need to do. They can also help with the civil commitment process and getting you to the local probate judge, because that is a legal process. And it's not that easy to navigate, honestly. And you need someone who can help you walk through the steps that you're take in order to file a petition to have your loved one committed to our system of care. And so that's the beauty of 988 is that it really is an easy way. People don't have to figure out, what's the name of my local mental health center? Which number should I call? Because the names are not really even intuitive. Like, you don't even think, like, they've changed their name, so, it doesn't say mental health center. It's Wellstone or Alta Point or Caristar. You don't have to figure all that out. All you really need to do is dial 988, and someone on the other end of that line can tell you where your closest crisis center is, tell you where your closest mental health center is, tell you what you need to do if you have a loved one who needs to go through a probate commitment.
Well, thank you for sharing that. And while we're talking about this particular matter, can you speak a little bit on the mobile crisis units? How many do you have, or how would, let's say, a municipality, a county official, anybody, how would they reach out for a mobile crisis unit?
So hopefully your local municipalities are working closely with their community mental health centers and with the crisis centers. A mobile crisis team can be deployed if, for example, someone is in the community and they don't necessarily have transportation to a crisis center. So there are mental health professionals as a part of that team. Those teams can be deployed. If a law enforcement officer runs into someone who's having a mental health crisis, if there's someone in the community that reaches out again through 988, those teams can be deployed that way. But particularly with law enforcement, many of our community mental health centers work closely with them, and they will make that phone call to the mental health center because they realize that they're in a situation where someone has a mental health issue. So that partnership between local law enforcement and the community mental health center that has that mobile crisis team is really, really critical. We also have several law enforcement agencies now where the community mental health center has deployed an iPad. And so they can actually, if they are in a situation and there's someone with a mental health issue, they can use that iPad and immediately connect to the community mental health center. And if needed, that mobile crisis team can come out. But it is a way in our rural communities for law enforcement and first responders to have immediate access to their local mental health professionals who in that moment can really advise them and talk to the individual who is actually there having the mental health crisis and make sure that they get to the right place at the right time.
That sounds like a great resource, and so I hope this will definitely be something that our members are able to follow up on if they do have questions about. But moving on, last year the Alabama legislature created the Interim Study Commission on PTSD in First Responders, and your team did a great job of really spearheading that commission. And I know that we were honored to have two of our team members, Richard Buttonshaw and Caleb Beck, be a part of that. It's my understanding that that commission was created at the end of the 2025 legislative session, and that leading up to the 2026 legislative session, y'all were tasked with basically creating some findings, surveying everyone, and seeing what recommendations y'all would have. So the commission has finished, I believe, and y'all have presented those findings. Can you tell us what the goal was of the commission and ultimately what were your findings and recommendations?
So I think the commission wound up getting established because of the growing understanding that first responders are really experiencing and much more vulnerable to PTSD. And so I think that was sort of the motivation behind it. And then the goal was really to make sure that those first responders could have access to the education, treatment, and recovery resources that are available out in the community. And I think a big part of the discussion as we were meeting is so often with first responders, they don't necessarily want to tell their supervisor that they're having some kind of mental health issue. because they're afraid they're going to be sidelined if they have that discussion with their employer or with their supervisor. And so there was a lot of focus on helping them really know what the resources are in the community, making sure they understood how to connect to those resources, even some innovative treatment options that are available, because a lot of our first responders are, not going to sit in a therapy session necessarily and talk about their feelings. They may eventually, but there's some really new innovative therapies out there that we wanted to connect them to as well. And so trying to make sure that they had every ounce of information they needed to be able to access those services and those supports anytime they wanted to access them. There was a lot of discussion about peer support programs in the first responder community. Those are really, really effective programs. And so there was a lot of support for some of the existing peer support, meaning, a fellow fireman or a fellow law enforcement officer who had been through a similar experience. And really, a lot of their environment is very conducive to them talking to each other and processing the things that they've seen, at an accident scene or on any given day when they come upon a situation where someone is severely injured. And so there really was, I felt like, a lot of support too, just for the environment that they're in and how to actually create that environment in a way so that they can process a lot of that on their own. But then when they need additional help, they know where to go to get it. And they don't necessarily have to say, they don't have that feeling of what's going to happen if I tell my employer that I'm having this issue.
Mm-hmm. Can you talk about some of the, specific resources that they have outside of the peer-to-peer support? I believe y'all have a Connect Alabama app. Is that one of the things you want to get into?
We have a variety of resources. And again, of course, 988 is an easy to remember number, but the Connect app is really wonderful in that it's all the resources statewide. So no matter where you live, no matter if you're looking for mental health or substance use treatment or recovery resources or your local AA or Al-Anon meeting, all of those resources are available by going to that app, and you can put in the city you're in and it'll pop up all of the resources that are available in your community. So it is really effective. And then, of course, we did some publications that, it has a QR code. So if people just want to scan the QR code and find, our crisis centers or many of the other resources that we have available, we really just wanted to make it easy for first responders to get to that information.
Exactly. I know your public information officer, Melissa Valdez, has done an excellent job working with our communications team, and we've been sharing that information in our newsletter and on social media, and we're actually working together now to coordinate an article with some more details on the things that you just mentioned for our summer edition of our magazine. So we'll be getting that out shortly, everyone. Moving on, I want to talk to you about our veterans. I know that Alabama is a very, very veteran-friendly state. About 1 in 10 Alabamians have served our country. And I'm told that y'all are using some of the opioid settlement funds for a couple of new programs. Can you tell us about those programs and any resources that you would like our members to share with their veteran constituents?
Absolutely. We are very excited about the work that happened through the Veterans Mental Health Steering Committee that was established in 2024. For the first time in Alabama, we have a comprehensive plan when it comes to veterans' mental health. And so that plan had a list of recommendations, and some of those recommendations were addressed through legislative action during the session. And then some of those projects that really needed to happen in the community, we were able to do through funding from the opioid settlement funds through the Opioid Commission. And so it was amazing to see all of that come together the way that it did, because there were a lot of people working on it. So one of the things that happened legislatively is the Houston Hunter Act created a program called Safer Together. So we know with veterans, more likely than not, a veteran is going to use a firearm in order to commit suicide. And so that's one of the issues. Having ready access to a firearm is an issue for veterans. We know from the data that if you can put even 2 minutes between the time that person thinks of suicide to the time they can gain access to that, you can really decrease the number of folks who die by suicide. And so this particular act would allow for individuals to voluntarily go to their local gun store, a licensed gun store, and store their weapon there. And so if they know, or if their family members, want to encourage them to go and store their weapons, so that when they are in a mental health crisis, they don't have necessarily ready access to that weapon. And so that was a huge thing. A young man named Jason Smith, who is a veteran, worked really, really hard on that bill. It's named after 2 young men who lost their life to suicide. And it was really wonderful to see that happen. The legislature also appropriated $5 million for the Veterans Resource Center here in Montgomery. So now we have a resource center completely devoted to veterans, particularly veterans who are transitioning back into civilian life. And that was really exciting to see as well. And then we also advocated for an increase in traumatic brain injury funding for the Department of Rehab Services. In our state, at the time we started this, the only way you could receive treatment through them for a traumatic brain injury is if it had happened within a 2-year window.
Oh, wow.
And so what happens with veterans a lot of times is they get home, they don't realize that they actually sustained a brain injury. And then once they figure that out, that 2-year window is gone. And so the funding that was appropriated would allow anyone at any time to be able to receive those services no matter when the brain injury occurred. And so the Department of Rehabilitation Services is standing up some traumatic brain injury centers around the state, really with a focus on veterans. But as we know, many of our first responders are also veterans. And so that was really, really amazing that they were able to do that. Their traumatic brain injury program is a nationally recognized program. We actually have one of the best brain injury programs in the nation in Alabama, a well-kept secret. So we were very excited to be able to support that for them. And then we did use $3 million in opioid settlement funds to promote pilot projects, innovative ways to address veterans' mental health in the community. We issued an RFP, and we have about 5 different agencies that responded to that. There's some innovative strategies there too, some new technology that is being used. There's a lot of telehealth, because we're really missing a connection with our veterans that are like 18 to 32. They're not showing up at the VFW or some of the places that our older veterans would show up. So we were really trying to increase the availability of telemental health to attract those individuals who might not be connected to the broader community. And all of those are on our website at mh.alabama.gov. There's a full list of the pilot projects. And then this past year, they appropriated another 1.5 to the Department of Veterans Affairs to continue those pilot projects. So I think a grand total of about a $12 million investment in that. So it was pretty impressive. Everybody working together, what we were able to accomplish.
Well, those are all definitely very critical and needed projects. So thank you for your work on that. With this being Mental Health Awareness Month, what are some ways that our members and citizens can get involved?
The theme this year is really all about connectedness, and More Good Days Together is really all about being connected to each other, because we do know that isolation is the worst thing you can do for your mental health. So COVID was actually one of the worst things that we could have done for our mental health. And so there really is a focus on being connected to each other, how important relationships are in the overall just general health, mental health, as well as your physical health. And so, I tell people all the time, if you know someone who's isolated, for whatever reason, reach out to them, make a phone call, go by and visit. You can't imagine how much of a difference that might make. And then if you're having difficulty with, relationships, and that's one of the areas that you're really struggling with, then find a good therapist. I still have my therapist. There are many people in our department that continue to do therapy. I think lots and lots of folks could benefit from therapy and helping you then get more engaged in your community. And then, of course, if you're in a crisis, then you obviously can go to one of our crisis centers or dial 988 to get to where you need to be. So those are the things we really want people to remember. But that connection to community is huge. We just did a Faith Meets Mental Health conference at my church a couple of weeks ago. And that was such a big part of the conversation. And often faith communities can really be a great way for people to be connected and to get the support they need so that they can be really mentally in a good spot.
I think one of the things that, even though we all had to go through the pandemic, one of the positives was that I think it allowed us to kind of talk more about, breaking this stigma of getting mental health help. So the items that you just mentioned, like with your church and everything, those are all positive initiatives, and hopefully it allows more people to have those conversations now. So I believe you've really given us most everything as far as your website, but if you don't mind, one more time, share that with us. And if any of our members had questions following this interview, what's the best way that they can reach your team, or what's the best way for citizens in general to get in touch with y'all?
So if there's a current mental health issue, obviously dialing 988 will get you to really all the resources in the state. If you want to download the Connect app, you can go to the App Store and download that. If you're someone maybe in the community that people, will ask, where do I go? How do I get help? That's a great way to know what the resources are. And then, of course, our website is mh.alabama.gov. You can find all of the Veterans Pilot Project information there. You can find lots of information about our crisis centers and how to access services through those crisis centers. And so lots and lots of resources available there.
Thank you, Commissioner Boswell. We really appreciate all of this great information that you shared with us today. And thank you and your team for everything that y'all do every single day for the state of Alabama. We also want to thank Governor Ivey, the Alabama legislature, and all of the members of the commission for their work on putting a focus on mental health resources in our state. So we look forward to working with your team to continue to share that information in our magazine and on all of our platforms. That's a wrap for this episode of Municipal Matters. Thank you so much for being with us today. We hope that you'll subscribe to our YouTube channel, My ALM TV, and be sure to like and share it with all of your friends. See you next time.
Municipal Matters is proudly presented by the Alabama League of Municipalities, the voice of Alabama cities and towns since 1935. To learn more, visit our website, almonline.org, and follow us on social media.